On the oncology floor, I see patients respond to treatment and their caregivers in many different ways. Ward, as a cancer survivor living with terminal cancer for over 3 years, what do you think is the patient's role in treatment?
Very often, we think of our doctors as being all-knowing, all-seeing. We've come a long way from the old days when we thought of them as demigods, but there's still often a big distance between the patient and the doctor. And even the other caregivers, nurses such as yourself and technicians. What I've come to is a realization that it's a team. The team involves physicians, technicians, nurses, specialists of all kinds. But if you think of that team in a huddle, circled around each other, at the center of that team, it's me. It's the patient. I'm on the team, and I'm the center of the team. I'm the cheerleader. I may not have the knowledge of the disease that the physician has. I might not have the compassion that you, the nurse, has. But the object of everyone's effort is me, the patient. And it's very, very important that I play my role accurately. And here are some things that I do. One of the things that I've learned is to make sure everyone on my team knows that I'm on the team. And so that means engaging them. So for example, when I show up for a doctor's appointment and they take my vitals, they weigh me and they do my pulse oximetry to find out how much oxygen's in the blood, and they do the blood pressure and temperature and all of that. You've probably done that a million times. And that typically gets noted, and then it's like, okay, well, let's walk down the hall and visit the doctor. Time out. Excuse me, what were my vitals? I don't need to know, and I probably wouldn't know one value from another. But if it's important enough for them to assess that, I think it's important enough for me to know it. And the truth is, I've learned to watch my blood pressure, things like that. What that does is it puts them on alert that I'm watching, that I'm involved, and I care. The other thing, simple thing, drives me crazy is when maybe a technician, a nurse's aide or somebody like that performs some task, maybe just ushering me in the room, and they have no name tag and they don't introduce themselves. What drives me crazy is they have access through the computer to my most personal, private information. They have more information on me than my family does. And I don't even know this person's name. I think I should. And what I found is that every facility, every organization usually has it as a rule. You should introduce yourself. But they get busy and they forget. By calling them on that and saying, excuse me, but what's your name? It kind of wakes them up. And that's what I want. I want them to know that I'm watching and they're on their toes. But the best thing that I do is I catch them being good. I'm not looking for errors. I'm trying to prevent them. So one of the things I do is whenever they do something that I know is right and good, I try to acknowledge them, even for the most mundane of things. For example, when I'm in chemotherapy in the infusion room, the nurses work with obviously more than one patient at a time. So as they move from one patient to the other, when I see them go over and wash their hands and change their gloves, and then they come to see me, I will stop and say, you know what, I really want to acknowledge you. I appreciate that you took the time to wash your hands. This may seem silly, but sometimes they actually forget. So I don't look for the forget. I acknowledge them for the right. And it's funny because it brightens their day. It's like, oh, well, yes, I thank you and appreciate that. So there are little things that get you involved and keep you involved in part of that. Because ultimately, you have the final power. As a patient, you can refuse a procedure. And don't be afraid to do that. I had a phlebotomist, that's the person who draws your blood, screw up the procedure. And they were ready to stick me with a needle without having cleaned with an alcohol swab my arm. That could give me an infection. I have a suppressed immune system because of chemo. I'm watching that. And I asked, I prefer that not be done. And I stopped the procedure. Don't be afraid to do that. Don't be afraid at all. Ultimately, you really want to have a good relationship with your doctor. You need to like your doctor. That doesn't mean be buddies, but respect and be able to communicate. Communication is critical. So here's the thing. One of the things that I've learned is that physicians have gone through the mill. It's like a meat grinder to become a doctor. Their egos have been beat down by their professors over years. They've been humiliated and made fun of and shamed in public and in groups. Don't be afraid to ask questions. You're not going to hurt their feelings. And if for some reason you're not getting the answers you want, if for some reason you're not feeling good about that communication, ask the doctor for a referral to another doctor. It's okay to find another physician. This person has your life in their hands. And if that's difficult for you to do, have your caregiver work with you. The point is, you're not going to hurt their feelings. So there's a lot you can do. Remember, you're not only on the team, you are the center of the team. You're the center of that huddle. Together, the quality of your life can be significantly improved.
Cut.